On the radiographic imaging, certain signs can be picked to diagnose certain pathology. Here on this image, you can appreciate abdominal radiograph, and on the abdominal radiograph, you can appreciate a single segment of dilated small bowel loop nearly in the center of the abdomen. So this is called a sentinel loop sign. Sentinel loop sign is demonstrated for the small bowel loop obstruction. So you can appreciate on these two images. On these two images, these yellow arrow indicating a segment of the dilated small bowel loop, and that is called as sentinel loop, which is diagnostic for the small bowel loop obstruction. On these CT contrast CT abdomen images, arrows are indicating a sign which is called as arrowhead sign, and this refers to the focal cecal thickening centered on the appendical orifice, and this sign is secondary to acute appendicitis. So here you can appreciate that the contrast material in the cecal lumen assumes as arrowhead configuration pointing at the appendix. So this arrowhead sign is pathognomonic for the acute appendicitis on the contrast enhanced CT abdomen. So here you can appreciate the arrowhead sign for the acute appendicitis. Here on this gastrographin enema, you can appreciate at the point of twist a characteristic beak-like termination of the contrast column. This is called as bird of prey sign, and this sign suggests sigmoid volvulus, and this you can appreciate on the enema. Gastrographin is used just to avoid if in case there is some perforation, so therefore we need to have the gastrographin. If you use any other contrast material, so this is contraindicated. So therefore if there is any suspect of perforation, you should have to use the gastrographin. So this is called as bird of prey sign, and it is because of the sigmoid volvulus. On this abdominal radiograph, you can see football sign. Football sign is seen in case of a massive pneumoperitoneum. You can see that the abdominal cavity is outlined by gas from a perforated viscus. Underneath that, you cannot appreciate any other vascular or any other structure. So this is what called as a football sign, and football sign is characteristic for the massive pneumoperitoneum.